Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jean Sarnoski, and on today's program we're going to learn a little bit more about the Falmouth Prevention Partnership Program, and we're lucky enough today to have as our guest the chair of the program, Dr. Michael Bihari. Thank you for being here. I appreciate your time.
Pleasure.
So I always like to start so our viewers get to know who you are a little bit.
Okay.
How long have you been in the area, and what was your interest in this program?
Okay. I've been on the Cape for about 12 years, moved here from New York. My background, I'm a board-certified pediatrician and have spent many years in patient health education around pediatrics and wellness, ran health centers. And for 10 years, I was on the board of the Community Health Center of Cape Cod and the president for 4 years. So I'm very interested in the community, worked a lot in the community. And 5 years ago, I was asked to join the steering committee of the Falmouth Prevention Partnership, which fit the kind of work I was doing because it's community-based, and it was specifically to help to decrease substance abuse in youth in Falmouth.
So your interest in this particular program was a natural fit with
absolutely.
the work that you're doing and the background that you have?
Yes, absolutely.
So what is your role in the partnership?
Well, I'm the chair of the steering committee, which is like a board of directors.
Okay.
It's not an official board because it's not a 501c3 organization. It's a community coalition. The town of Falmouth received a grant in 2008 from the federal government, over $600,000 for a 5-year period, specifically to create a coalition of community members to help reduce substance abuse among Falmouth youth.
Wow. Yeah. That was an insightful goal.
Yes, it's a national program, and there are about, I think, several thousand of these around the country.
Yeah.
Yes, and the only other one in this area on the Cape is on the Vineyard.
So how big is the group that you're working with?
Well, the coalition itself is made up of over 100 individuals and about 30 or 40 organizations. But there's a smaller core group called the steering committee, which is responsible for the day-to-day management. And the funds were used to hire 1.5 staff members.
Okay.
1.5 FTEs.
Okay. So when you talked about some of the affiliations or the groups that are involved, so who is the coalition? Who is the partnership?
Right. The federal grant, which has now ended, dictated very wisely that all of the sectors in the community that affect the well-being of youth need to be represented in the coalition. So healthcare providers, media, law enforcement, faith-based community, any organizations that provide mental health or substance abuse for kids, the school system. So, and they are all represented. And we've been fortunate in Falmouth. The police chief or his designee is on our steering committee.
Oh, nice.
The superintendent of schools is on it. The special sheriff from Barnstable County, Jeff Perry, is a member of the steering committee. So it's very robust, and it does represent the community.
How many on the steering committee?
The steering committee, it sort of comes and goes, depending, over 5 years. There are 9 currently.
Okay.
9 members right now.
How often do you meet?
We meet once a month.
Okay. So everybody stays
Everybody,
well
yes, and
connected?
there's a lot of going back and forth with emails and things like that. But we have a staff who do the day-to-day work.
Right. So there's a program director.
Program director, and then there's a half-time person who does a lot of the coordination work in the community.
So what kind of work does the program cover? What do you do?
Well, the program, the feds were very specific that the money was not to be used for treatment. It was to be used for prevention.
Prevention, which is in the title, right?
Yeah,
yes.
Primary prevention. And so what we did initially was to assess the problem in the community. And we did that with focus groups, talking to community leaders, and conducting a validated, in-depth survey in the Falmouth schools, public schools, and the Falmouth Academy. We had great cooperation, And virtually all the kids from 6th grade up participated in the survey. It's something that's used nationally. And the results then helped us see what the issues were. So we focused on 3 things: on underage drinking, on marijuana, and on prescription pill abuse. And we had initial data showing what the amount and rate of those things were.
From the children themselves. Right? You feel like it was a pretty honest.
Oh, absolutely!
It was all anonymous.
Absolutely! It's a survey that's used all over the country, and is well respected and validated, and it has built-in questions that are trick questions.
Yes.
So if the kids answer those in a certain way, their surveys are thrown out. And there were very few of that.
Oh, yeah.
And there were a few parents who didn't want their kids to participate.
Sure.
But it's got, several hundred questions, and it really gets into depth about the kids' perception of the community and the perception of their parents' approval or disapproval. So it gives us a really, really good picture of where the kids are at.
Mm-hmm.
And very interestingly, we repeated that exact same survey every 2 years. We just completed the 3rd one, so we can trend and see if the programs we've instituted have made any difference.
Yeah. Wow. Good check system.
Yes, absolutely.
How many answered the survey? I'm just curious.
I don't remember the numbers. Hundreds.
Thousands?
Oh, hundreds.
Hundreds.
Yeah. So
you
it
have a
was
good
the
taste of it.
entire high school and the middle school.
Okay. Now, and you did tell me again, it was underage drinking? So
Underage drinking, marijuana, and prescription pill abuse.
Okay. So then the programs that your group worked on were designed to address those issues.
To address those. And to really change community norms. So a number of the programs, there's one program called Parents Who Host Lose the Most. And this is a program focusing on parents around the social host laws, in which the social host law in Massachusetts is against the law to serve alcohol to anyone under age 21.
So what were you finding, that some parents, as long as it's in the safety of my own home,
yes,
they were okay with
myth,
that?
That's right. That is a myth. And so parents would have the party at home. They would actually provide the alcohol. They would take the keys, so the kids couldn't drive. And to them, that was the best way of doing it. The problem is it sends a very bad message, number one. Number two, it is against the law. And number 3 is the number 1 cause of death in young adults from alcohol is alcohol poisoning, not car accidents. The car accidents are serious, I'm not diminishing that, but it's alcohol poisoning.
Wow.
And there have been several deaths in Falmouth
Yeah.
over the years from that in teens. So what we did was to focus on the parents, and the school instituted several years ago an assembly before the prom, and if the parents didn't come to that assembly, the kids couldn't get their prom tickets. And that was instituted by Falmouth Police. And we've piggybacked on that, so when they do the assembly, we have a law firm from Boston, Campbell and Campbell, and Richard Campbell is one of the country's experts on social host laws, and he's an incredibly dynamic speaker. So he comes down, he's part of the assembly, and this past time, when we did it this past spring, within a half an hour, there were texts flying around and tweets and everything flying around Falmouth. 3 parties were canceled.
Really?
So the kids then went to the schools after prom party where there's no alcoholic drugs.
Right, right.
And what was most interesting and what we're most pleased about, when we did our first survey, the rate of underage drinking was about 50% in the high school.
And that was
And that's
5 years ago?
That was 5 years ago,
Okay.
and that was the measure is, the question is, have you had a drink within the past 30 days?
Okay.
Okay, so, and that's a national kind of norm that's asked, and 50% of the kids said
Oh.
yes.
Yeah.
That's a lot. At the same time, one of the questions is asking them whether or not their perception of their parents' disapproval of them drinking. And they're correlated. So that in the first year was 68% of parents disapproved. Last year, the underage drinking dropped to 38%, so 12% drop, and the notion of parental disapproval rose to over 90%.
Wow.
So it's been
Success.
great.
Yeah.
Success.
Yeah.
Yep. Yes.
So how about another one? The second?
Well, another one, we do community education. I write an article in the Falmouth Enterprise every week called Risky Business, which is really mostly about parenting. Another program is Sticker Shock. And what we do is the two biggest drinking times of the year are right before graduation and now, right before the holidays, including the holidays.
Wow.
So we do two programs a year where kids from local churches and from the schools with an adult chaperone go to every single store in Falmouth that sells liquor. There are 16 of them in our little town, and they put a sticker on the bags that the bottles go in, and the sticker again reminds everybody it's against the law to serve anybody under age 21. And each time we do this, we probably put stickers on over 10,000 bags.
I bet.
In every liquor store.
And it's the kids that are involved.
It's
in
the kids are
getting it
involved,
distributed.
right? And the liquor stores are, all go along with it.
Right.
So that's a great program. And the other big thing we've done is work to get drugs off the street. We cooperate every year with the DEA's drug take-back program.
Okay.
And this year we reached out to all of the police departments on the Cape to help them set this up and do it. So this year, every single police department cooperated in the DEA take-back.
I'm just going to back up just a
Sure.
second for viewers that. What is the DEA
Well,
drug take-back program?
this is a national program.
Okay.
It's done twice a year, and it encourages people to bring their drugs that they don't use anymore, that are outdated, that they don't
Prescription
need,
drugs?
prescription drugs,
Okay.
and over-the-counter
Okay.
drugs as well, and to bring it to a drop-off point, which is usually a police station, where they're collected anonymously. You don't have to give your name or anything, and then the police bag it and take it to a site where the DEA picks it up and then properly disposes of it. We've been very successful in Falmouth with it. So the partnership in collaboration with Cape Cod 5 paid for a kiosk to be in the lobby of the police station. It's available 24/7 where people can come and drop off drugs. And there's a bin inside of it. It's one of these blue recycling bins.
Oh, yeah.
And about every 7 to 10 days, it fills up.
So this is a standing
thing.
365?
Yes,
It's always
365, and
And
again,
is this just at the
anonymous.
Falmouth station?
No, well, we paid for one there.
Okay.
There's now one in Mashpee.
All right.
I think Yarmouth may have one. I don't know about
Okay.
the other towns, but slowly but surely they're beginning to put it in. And we work with some of the funders on the Cape to try and distribute these as well. So hopefully by the next time we do the DEA take back, everybody will have a kiosk 24/7.
Yeah. So this particular one was funded by Cape Cod 5. you
And
said?
the partnership.
And the partnership.
Yep.
Okay.
Yes.
Are there other funding sources for all your activities, like the stickers? Or is
Yes.
did that
Well,
come from
initially all of the funding came from
the grant?
the grant from the federal government. That ended September 30th. Our current funding is from the Kelly Foundation, Woods Hole Foundation, from Community Benefits, and we recently just got a large grant from the Tower Foundation.
Oh, all right.
To continue for next year. So funding will not be an issue. This is,
that way.
These programs are,
Right.
there's lots of money out there for them.
Yeah.
Yeah.
So in the survey, I'm going to the DEA take
Sure.
back. So it showed up that pill abuse was one of the highlighted
Yes,
items.
I mean, one thing we know over the past 4 or 5 years, there's been a growing concern about prescription pill abuse in teens. And what they'll do is take the medication to get high. There are two main things that the kids are doing. One is using narcotic painkillers to get high.
And they get them?
They get them mostly from home. And this is, people think the kids are going to dealers and getting them from drug dealers. 70% of the kids who abuse prescription medications get them from a family member. They'll go into the medicine chest and take them.
70%, wow.
Or 70%. And they'll go into grandma's purse. You know, she's walking around with, you know, some narcotic painkillers for her recent, you know, knee surgery or hip surgery or dental surgery. So there's a lot of these medications floating around. In fact, the last time we did the drug take-back, I went through my medicine cabinet and I had had several extractions, and every time I had an extraction, the dentist gave me a prescription for, you know, Percocet or Vicodin, which I don't usually get filled, but I did a couple of times and it was sitting in the back.
Just in case.
Just in case. I brought that in to get rid of, and it was close to $3,000 street value. Of narcotic painkillers. So, and that just came from me. So there's a lot of it around.
And people have no idea, I would guess. Viewers would have no idea that whatever they have in their medicine cabinet at home, number one, is that kind of distraction.
Correct.
Or has that kind of value.
That's correct. The most popular drug of abuse, prescription pill of abuse on the Cape is Percocet 30 milligrams. The kids refer to it as Perc 30s, and they sell for about $1 a milligram. So a 30 milligram pill is $30.
Wow.
And that's expensive, and you know, so they steal it and take it themselves, or they steal it and sell it to their friends. With all of the programs that we're doing and with the drug take-back, the supply is getting tighter. So the problem is the cost of these pills have gone up on the street. And unfortunately,
the supply on the street is getting tighter.
Is getting tighter
because of this education.
Right, and it has
some of the
unfortunately a side effect that we really didn't anticipate. The kids are, since they can't afford the pills and can't get the pills, they're turning to heroin, which is very, very cheap. So for the $30, you know, for one perk, you could probably get enough heroin to shoot up for 3-4 days. So we're seeing this resurgence of heroin, and we're seeing kids winding up in the emergency room, dying from overdoses. And unfortunately, Boston and Southeast Massachusetts has one of the highest rates in the country of emergency room visits for narcotic overdoses. It's usually number one.
Wow. Do we know why?
Well, I'm not sure. I mean, there's a lot of young people in Boston.
Just population?
Yeah, it could be the population, but, you know, I
Access
don't know.
somehow is a little bit easier right on the coast.
Yeah,
just
don't know.
lands right here. I don't know.
No.
Yeah. Wow, good effort. So the viewers may have seen, and I wanted to ask you because I've seen it myself, ad on television where an elderly person or an older person opens up the medicine cabinet and it's a mirror shot of them, and then takes out a pill, takes it for whatever they have going, they shut it, and there's a young person standing there grabbing the same bottle.
Correct.
Is this a similar program?
Yeah, it's a similar kind of program. One of the things we've done, you know, we're educating people about this, and we're doing the pill take-back program, but we're beginning to focus on seniors in a program called Lock Your Meds, which we launched about 2 months ago. We did a big campaign in Falmouth and Mashpee. We had ads in the paper. We had a poster that was an insert in the paper 2 weeks in a row in both towns. I've given a talk about this at Mashpee Senior Center. The police chief and I in Falmouth met with about 110 seniors last week and talked about this. So we're trying to educate the population that is the most likely to have these medications prescribed.
Are you finding that they themselves are surprised? Are the people
Yes,
that are listening?
well, it was interesting. Some were, some weren't. I mean, some, you know, were aware of the issue, but yeah, most people were, you know, surprised, especially about this 70%.
Yeah,
figure. And when you begin to look at some of the statistics, they're very shocking. They're nationally between 2,500 and 3,000 kids every day start taking a prescription medication to get high.
Wow.
Every day. So these are new users.
Right.
So, and they have easy access because they can get it at home.
At Grandma's
So-
house or at my house or
Yes,
whatever.
that's right.
Yeah.
That's right. And the other issue with the medications at home is proper disposal. And also 80% of kids who accidentally, little kids who accidentally overdose on medications they get from home.
Oh, wow.
So there's lots of reasons to
Yeah.
protect your medications,
Right.
To help the environment and to help,
Right.
kids.
Can we talk about academic doping?
Yes, academic doping. That's the other
That was
issue.
a term I had.
Right.
What is that?
What is that? Most of the kids don't get those pills at home because parents and grandparents don't take stimulants for
Okay.
the most part. Academic doping is the notion that if you take medications that are used to treat attention deficit hyperactivity disorder, such as Ritalin and now more popularly Adderall, that it will help you focus and do better in school. It's a little bit of a problem locally at the high school level, but it's a very, very big problem among youth in colleges. The Adderall, if you have ADHD, it calms you down and helps you to focus. If you don't have ADHD, it's similar to what we used to call speed back in the
So it
60s
has
and
the
70s.
reverse effect.
Has a reverse effect. It makes you extremely hyper, and it does help you focus. It doesn't teach you calculus. It doesn't give you the answers, but it helps you focus. And the kids think, well, they'll concentrate when they're
Right.
taking an exam, or they can concentrate on their studies, stay up all night and study. The problem is it doesn't work. They're beginning to do some studies now at the college level and talking to kids, and anecdotally they're finding things like, the funniest story that I heard was a young freshman boy who on a Friday afternoon started taking Adderall. He was going to study all weekend, and about an hour after taking the pill, he was staring at his books and noticed that his desk was messed up. And for the next 3 hours, he cleaned his room. He polished the floors. Now, can you imagine, an 18-year-old boy on a Friday afternoon, cleaning his room?
His room.
But
Oh,
so
my.
it does help you focus, but
Yes.
it doesn't.
Not on the right
so,
place,
so it
yeah.
doesn't work.
Right.
The danger of it is, the drugs aren't terribly addicting, but the danger is that if you take more than you should, or take too much of it, it can make your body temperature go up. It makes your blood pressure go up. It can cause arrhythmias in the heart, and there have been kids who have died, taking it.
Right.
So,
Right. Wow.
yep.
So education seems to be the
Yes.
biggest tool that we have to
Yes, for that.
counteract any of these
Yes,
activities. Right?
correct.
And that's the focus.
Well, yes, the focus
Of your organization.
is education and doing programs that are going to change norms, and I think we've done a decent job with the underage drinking. A big issue is marijuana. That's the second most commonly used drug.
Right.
And with the changes in the laws in Massachusetts, it's hard to get that message out.
Yeah.
And everyone is predicting that 4, 5, 6 years from now, it'll be legal recreationally here.
Sure.
So it is an issue.
That's a tough one.
Yeah, so this is a tough one.
Yeah. We, believe it or not, we only have about 2 minutes left.
Oh, really?
I know, time flies when you're having fun.
Yes.
So we've touched, I think, a good hit on the alcoholism,
Yes.
the pill, education.
Right.
Are you finding that some of the other towns on the Cape, sounds like such a great program, and you've had such good success with the
Right.
survey measurement and everything. Is it something that is gaining some interest Cape-wide?
Oh, absolutely. We are working with Mashpee. Mashpee has created something called Mashpee Cares, which is their coalition, and they need to figure out what the needs are in their town. But we're providing support and consultation to them. And for some of the programs they've instituted at Mashpee High School, we've provided some of the funding for that. peer mentoring programs and things
Okay.
like that. And we've been asked by other towns and groups in other towns, you know,
have you?
for
Yeah.
some input and advice. And hopefully going forward with funding is to begin to spread some of this around other towns. It's not a thing that you can franchise
Yeah.
because each town is different. But we certainly can work with towns and say, hey, look, this has worked in our town, and you might want to try something like that.
Right, right.
And we're also are developing a fairly close affiliation with Gosnold.
Okay.
And Gosnold is getting into secondary prevention and are interested in working with us around primary prevention. And they have grant funds to begin to put counselors in some of the schools. So we could work with those counselors. They would do early intervention for kids who are at high risk, and then we would wrap prevention programs around that and work with parents
Right.
and stuff.
So for viewers, Gosnold is what kind of?
Gosnold is a not-for-profit organization that provides substance abuse treatment, rehabilitation, mental health counseling.
And that's available too. That's a Cape-wide.
that is Cape.
access.
Yes, that is Cape-wide.
So that's a good partnership.
Yes,
to have,
that's a
yeah.
good partnership for
Right,
us.
right. Now, what do you consider to be your greatest successes so far?
With the partnership?
Yeah.
I think it's the reduction in the alcohol
That
and
must
the
have been-
underage drinking rate.
Yeah.
We were really pleased with that. Our goal was to reduce it by 10% over 5 years, and we, you know, succeeded.
Right.
And went beyond that goal. So I think that's the greatest.
That's the biggie.
And also having a stable community coalition and getting people interested and involved.
And as you mentioned, likely not to go away, even though
Nope,
the
we'll-
grant has gone away.
Yep.
There's a lot of
Yes, it
community interest.
will not go away
Yeah.
at all.
Well, thank you so much for
It's a
being with
pleasure.
us and informing everyone of well, the partnership is great, a great program.
Great. Thank you.
Appreciate it. And I'm Jean Sarnowski, wishing you good health and good health care.